This is Jerry Hesch of the Hesch Institute. We have a clinic near Las Vegas, Nevada and Henderson, Nevada. And you're looking at a pair of feet here, and these feet belong to Ben, who's a physical therapist who practices in the Boston area. And he's out in Henderson for a sports convention. And we don't have the best angle, so here's what I'd like to do is have you turn around and get your feet hanging off the other edge, because then we can film a little bit better angle. So Ben came to see me mostly for what's becoming chronic left SI pain, and we treated his SI, and I think that will be very helpful to him. And his right midfoot got my attention, and his midfoot was quite restricted. I can pronate his left midfoot somewhat. There's some play. On the right, it's very rigid, but I believe that the subtalar joint is driving the system. So let's see if I can try and keep out of the way of the camera. His left subtalar joint, I can push the calcaneus towards neutral. On the right, it's extremely rigid. Okay? On the left, I can rotate, and you can probably see that the whole foot moves it. Of course, I'm not constraining the ankle joint. I'm letting it move with subtalar joint. Okay? On the right, very little movement. And if we rotate calcaneus laterally, very little movement there. Again, on this side, if we rotate the calcaneus medially, you can see the whole foot moving laterally, and we can also rotate it this way. Okay? So we could then go and lock, or attempt to lock, the ankle, the talocrural joint, and you can see that he still has some freedom, a little bit less of abduction, and a little less motion, of course, in both directions. And on this side, still very, very constrained in both directions. So what I would like to do is distract this subtalar joint, and I'm going to mobilize the calcaneus. I'm going to mobilize the back of it medially. Okay, I'm going to go ahead and lock the talocrural joint, and I'll do about 30 reps there. I like to distract it inferiorly for about 30 seconds to get as much slack taken out of the system. I don't make the assumption that I can take up the slack in 2 or 3 seconds, so I like to add a generous 30 seconds to that. And again, I am trying my best to block talocrural motion. And then I just add gentle abduction of the calcaneus, keeping the distraction. And we could hold a steady force, we could add oscillations. I'm not sure that it really matters. If I were to oscillate it, I would oscillate it for at least 30 times. If I were to just hold the force there, I would hold it for up to 2 minutes. Okay? And in this position, with him prone with feet hanging off the edge, the joint is least constrained. Okay, so this is a very, very optimal position to mobilize the subtalar joint in. And it feels to me like we've accomplished some things. So let's see what we've done here. It's certainly not as well. Actually, let's stop constraining the. Yeah, that seems similar to the left. Why don't you walk around and tell us how you feel? But first, just before that, let me just see what the midfoot does. Yeah, the midfoot's freer. Can you feel that the midfoot is?
Yeah.
Okay. Why don't you come and walk out here and give us some feedback? Any idea how you got this restriction in the subtalar?
No, not at all.
Okay. No idea how long you've had it?
At least 3 years, if that.
And maybe
Maybe longer.
You were a soccer player. So, you know, that could easily explain it, right?
Right.
Sudden deceleration with your body twisted. So anyway, keep walking and just give us some feedback.
Yeah, it feels good, but you know, I wasn't really having any symptoms there initially, so.
What does good mean?
I guess normal, like
Okay.
how I normally walk.
So did it feel differently when you walked in the door?
I can't say that it does, but it felt good, so I wasn't really paying attention to it walking in the door.
So when you say it feels good, it feels like there's a change? Is that what you're describing?
Not that I can really notice, but definitely a change from feeling how when you were mobilized.
When my hands are on there,
Absolutely.
you can tell there was a restriction. You can tell now that restriction
Yes.
isn't there.
Yeah, it's definitely more mobile.
Okay, alrighty. So I think that might be the beginning of your problem. Okay, if you have reduced subtalar motion, then when you use your upper body and you bend over clients and what have you, because you work as a physical therapist, you know, you may have reduced transverse plane motion, you know, reduced eversion in that ankle, and so you're probably going to twist somewhere above to compensate, and it might be the SI. And we treated your SI for a left torsion, which I prefer to describe a left lower quadrant prominent and restricted. And you also had an advanced pattern that I've named as an oblique upslip. And those you can self-manage. But I think the subtalar joint might be the source of that. So what I want to do is teach you how to keep the subtalar motion, how to maintain it, and address those other things. So I'll stop filming now.